The pandemic creating an impossible economic situation for some Americans. NBC News Digital reporter Phil McCausland reporting the costs of masks and tests deepens a pandemic wedge between the haves and the have-nots. Phil joins me now. So, Phil, we're talking about higher quality masks, testing more frequently. Those costs can really add up, especially for people who are just getting by. Harvard University sociologist Daniel Schneider telling you, for many of these workers, it's just not a possibility. This is about food on the table. And when you face that impossible choice, the devolution of pandemic prevention to impoverished workers is really unrealistic. What else did he say?
Well, Schneider operates the Shift Project there at Harvard, where they've been talking to wage workers for a number of years now, even before the pandemic. But they've been surveying workers more recently as well. And they have some really interesting information that they've kind of learned from it. During the pandemic, 3/4 of these wage workers have found it difficult to make ends meet. 40% couldn't afford a $400 emergency cost. 20% also went hungry and because they couldn't afford. And about half of them are without sick leave. And you're thinking about, pandemic prevention right now, right? And, now there's the recommendation for N95 masks, KN95 masks, as well as rapid at-home tests. I mean, the masks themselves are $1 a piece. And then we're talking about these rapid tests that can be as much as $25, if not more. These are big costs, especially for families. And so when it comes, to them having to shell out for this, it's just a greater and bigger burden for them consistently.
You also spoke with a disabled man who lives in Brooklyn about the cost of this pandemic. What did he tell you?
Yeah, he said, it's the anger and sadness, over the response, I think, has really defined his time during the pandemic, because we don't really talk about disabled people. His chronic illness means that he can't really be out in public. He can't really interact with people. And it also means that he can't work. So during the pandemic, it's been, the price of any of this has been really, really challenging for him.
Yeah.
But now getting these masks, finding rapid tests, he has access to a ride to maybe one store per week, but otherwise he doesn't. So he can't go shopping around. Finding tests also is important, not just for himself to keep himself safe, but he has, at-home care workers come in, and he wants to test them to make sure that they're also not sick and spreading the disease to him and his roommate. It's really a kind of an existential issue for them, because the disease can do a lot more damage to them than it might do to someone who's healthy.
Yeah. The White House is saying private health insurance companies have to reimburse up to 8 at-home COVID tests a month. Starting Wednesday, the administration is giving each U.S. household up to 4 tests for free. What else do experts you spoke with say that we need to do for our most vulnerable families? That's a help, but I imagine it's not all that they need.
Yeah. The simplest thing is we just need, easier access to masks and tests. And access is also that financial cost, right? We look at other countries that, we consider along our lines. They're free. Tests are free in the UK. They're just a couple of dollars in France and Germany. They're really easy to get. And the point is for people to use them and use them consistently. One scientist said to me, these tests aren't perfect, right? We've seen, I think, increasingly so that the tests are not 100%. But if we think about them as a rake, they're pulling back leaves, and every time we get a better sense of where the virus is, and we get to respond in the correct fashion. We're talking about really vulnerable Americans here who are on the front line. We're talking about grocery workers, warehouse workers, just those low-wage workers who are really public-facing. And they're more likely to, come in contact with the virus. So it's really in defense of them. And, helping them also kind of helps us all deal with the pandemic as well.
Some members of Congress are putting pressure on the administration to do more about this virus. What specifically are they asking for?
I talked to Congressman Ro Khanna about this, a close ally of Bernie Sanders. They've brought back a bill that they had proposed last year, which has really put pressure on the Biden administration. They're pushing for 3 free N95 masks for every American to be sent to them in the mail. They're also pushing for the president to use the Defense Production Act to increase the production of tests and masks as well. I mean, the ultimate desire is, again, they want to get us closer to the response that UK, Germany, France, even India are doing right now, and making sure that people have access to these tests and masks. And I think, we might say three masks. It's not a huge amount, but most scientists, you can stretch out those masks for about a week. So we're saying 3 weeks of defense. And if you think about it too, it's kind of a public marketing campaign saying, hey, these are the masks that you should really have an eye out for and try to get for yourself and your family.
Phil, really important reporting today. Thanks so much for coming on to share with us.
Yeah, thanks for having me.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.